Hello and welcome to the IMV Imaging Journal Club. Today I'm going to be discussing the radiological prevalence of osteoarthritis of the cervical region in 104 performing Warmblood jumpers. I chose this paper because in practice I found that assigning clinical relevance to enlargement or radiological signs of osteoarthritis of the articular process joints in the cervical region is really quite difficult, because I did recognize that quite marked changes can be seen in otherwise clinically normal horses. This paper was chosen from the Equine Veterinary Journal and it was published last year in 2020. The cervical articular process joint osteoarthritis has been demonstrated as a potential source of ataxia or neurological gait deficits, both lameness and poor performance, as well as neck pain and stiffness, and also abnormal posture. Osteoarthritis in general is really quite common in sports horses in various different articulations. And with regards to jumping horses, the very large range of motion at the base of the neck potentially predisposes these horses to osteoarthritic type changes. And so during the jumping phase, we have quite marked extension of the neck during takeoff, which is quite quickly followed by marked flexion during the landing phase. Osteoarthritis of the articular process joints has been described in clinically affected horses. However, it has not been described in horses which are otherwise performing normally and with no clinical signs. The aims of this study were threefold. Firstly, to report the radiological findings in the base of the neck in sound performing Warmblood jumping horses. Secondly, to determine the level of agreement between radiologists. And thirdly, to test for associations of osteoarthritis with variables including broadly age, performance level, neck range of motion, and the presence of pain on palpation. The hypotheses were that the prevalence of osteoarthritis would be similar to that which has been previously reported in clinical populations, and then it would be greater for the caudal articular process joints. They hypothesized that the agreement among radiologists would be variable. They didn't go into any more specifics than that for this hypothesis. And thirdly, that the various variables, including age, performance level, range of motion, and pain, would all be associated with the prevalence of osteoarthritis. The inclusion criteria was that they included horses which had competed in at least 10 or more classes at the HITS Coachella Desert Circuit in 2018. Horses which had been treated with steroidal or non-steroidal medication in the 14 days prior to competition were excluded. A lameness evaluation at walk and trot in straight lines and circles was carried out, and any horse demonstrating a greater than 1 out of 5 lameness score were excluded, and similarly, following a neurological examination, any horses displaying more than grade 1 out of 4 ataxia were also excluded. Physical examination was carried out by one board-certified surgeon, and this included the assessment of whether there was a pain response when pressure was applied to the left and right articular process joints simultaneously, and also the range of movement from left to right was assessed. And so a normal was described as when the nose could reach the stifle when a carrot was held there. Mild restriction was when the nose could be brought to the side to the last rib, and moderate to severe restriction was when the nose could pass no further caudally than the 13th rib. Image acquisition included lateral views of the articular process joints from the 3rd to the 7th cervical vertebrae. This was performed in the field using a portable digital radiography system. Interpretation was thereafter applied by 3 separate radiologists with a varying length of having been boarded. Each articular process joint pair was categorized as either normal, mildly enlarged, which was described as when there was minimal to equivocal changes or enlargement, and the intervertebral foraminae were open, as is shown in this radiograph on the right. Moderately to severely enlarged articular process joints were designated when there was clear enlargement of the articular process joint, leading to a complete obscuration of the intervertebral foraminae. Statistical analysis was performed based on the median grades assigned by the radiographers for each articular process joint pairs, and this was used for further analysis. A mixed effects analysis of variance was performed to compare the grade of osteoarthritis with articular process joint level and age of the horse. Spearman's correlation coefficient was applied to test for associations between osteoarthritis grade with age, performance, and range of movement of the neck. For the associations between osteoarthritis and neck pain, a Kruskal-Wallis test was performed, and to determine the level of agreement between the radiologists, a Kappa-weighted test was performed. So moving on to the results, 104 horses met the inclusion criteria and weren't excluded as a result of the exclusion criteria. To overview these horses, the median age was 10 years, and that ranged from 6 to 18 years. Fairly typically, there were more geldings than mares and stallions respectively, and the median level of performance, which was measured by the height of fence that the horse was jumping on the day, was 1.3 meters, and that ranged from 1 to 1.6 meters. The median peak performance, which was the highest fence height that the horses had previously competed at, was 1.4 meters, and that ranged from 1.2 to 1.6 meters. About 1/4 had mildly reduced range of motion of the neck, and 14% had moderate to severe reduction in range of movement of the neck. And 33%, or just over a third, had neck pain on palpation. They found that the prevalence of osteoarthritis increased gradually from C3 to C4 articular process joints to the articular process joint between C6 and C7. If we look at the graph here, on the y-axis, that is the number of observations, and on the x-axis, we have the 4 articular process joints levels. 0 is pertaining to normal articular process joints, 1 is mild enlargement, and 2 is moderate to severe enlargement. What we can see is that the number of normal sized articular process joints decreases as we move further caudally, and at the same time, the number of both mild and moderate to severe enlargement of the articular process joints increases at each caudal location. Statistically speaking, there was a significant difference between the osteoarthritis grades at the level of C5 to C6 and C6 to C7 when compared with the more cranial locations of C3, C4 and C4, C5. Regarding the associations between osteoarthritis and these various different variables that they looked at, there was no association or correlation between age of the horse at the time of evaluation, the age when the horse started jumping, the current performance level, and also the range of motion and the presence of pain in the neck region. There was a positive correlation between the presence of osteoarthritis at the level of the 6th to 7th cervical vertebrae and the peak performance historically of the horse. The agreement between radiologists was variable as they predicted. The kappa values were reported as 0.37, 0.38 and 0.61. When considering kappa values, a value of 1 represents a perfect agreement, 0 is chance agreement, and -1 would be perfect disagreement. They reported that, or they interpreted these kappa values as being an agreement which is fair to substantial between the radiologists. However, if we look at published interpretations of Cohen's kappa values, actually the interpretation is perhaps more accurately thought of as being minimal to moderate. So I think they perhaps slightly overstated the level of agreement with the words they chose for their interpretation. There were statistically significant differences between all radiologists for the cervical vertebrae of 5-6 and 6-7. Revisiting their aims, they did succeed with their aims. They did report the radiological findings in these horses. They did determine accurately the agreement between radiologists, and they did manage to attest to the associations as they wanted to. Looking at their hypothesis, they did prove the first two. So the prevalence of osteoarthritis was similar to that reported in clinical populations previously, and was greater for the caudal articular process joints in comparison to the more cranial ones. The agreement among radiologists were certainly variable, as they predicted, but what I will say is that I don't feel that this hypothesis was specific enough, and it's not really a particularly testable hypothesis. With regard to their final hypothesis, looking at the associations between certain variables with the presence of osteoarthritis, for the most part, this was disproven. There was no association between age, range of motion, and pain, and most of the performance factors that they looked at were also not associated with osteoarthritis. However, they did find that there was association between peak performance level and osteoarthritis at the level of C6, C7. So it was, in a way, partially proven. So moving on to a bit of discussion. Osteoarthritis is common in the articular process joints of C5, C6 and C6, C7 in performing horses. Further to that, 1/4 had moderate to severe osteoarthritis of the articular process joint of C6, C7, which is perhaps quite surprising for otherwise apparently normal horses. The previously reported prevalence of osteoarthritis in a clinical population has been reported as 50%, 97.5%, and 17.4%. I think that this is actually represents quite a variability in reporting of the prevalence of osteoarthritis. And so thinking back to their hypothesis, and that they proved their hypothesis with regards to the prevalence being similar in this population to the clinical population, actually, I think there's quite a lot of disagreement amongst the clinical populations. Of course, some of these populations were different. For example, the latter population, when the prevalence was 17.4%, it was a much younger cohort of horses, which may have contributed to this. The articular process joint at the level of C6, C7 undergoes much greater range of motion than any other of the cervical joints. Therefore, is there a predisposition to the development of osteoarthritis as a result of this cumulative stress? There is potentially a predisposition for jumpers owing to the much larger range of motion undergone during takeoff and landing, perhaps in comparison with the movement that would undergo the neck would undergo during other disciplines. However, there are no comparisons existing with horses competing and working in other disciplines, so this is just conjecture at the moment. Now, contrary to previously published studies which did find an association of osteoarthritis with age, this study did not. This may have been a result of the relative homogeneity of the cohort with respect to the age of these Warmblood horses, and a lack of younger horses for comparison. Further, perhaps surprisingly, there was no relationship between the presence of osteoarthritis with neck pain or range of motion or neck stiffness. The relationship between osteoarthritis of the articular process joints and performance in general is known to be controversial. This study does not necessarily support a relationship between range of motion and pain on palpation with osseous abnormalities. Of course, this study didn't look at the general performance of the horses. It is possible that the range of motion and pain on palpation may have been associated with other factors, for example, soft tissue flexibility and muscle status. This sort of leads us to the question, is articular process joint osteoarthritis overdiagnosed? Well, looking into this a little bit further, in addition to what we found out from this study, we do also know that neck stiffness when ridden is frequently a clinical sign of pain which causes lameness, caused by lameness distant to the neck, for example, high limb proximal suspensory dysmopathy. Now, looking back into this population, does this potentially translate into this study? We certainly cannot rule out that these horses didn't have bilateral high limb lameness and potentially other issues too, and I'll discuss that a little bit more in the limitations. Further, and quite interestingly, there was a recent computed tomography study which showed that unilateral or bilateral enlargement of the articular process joints may be present in the absence of any evidence of degenerative joint disease. And so you can have enlargement without any other further abnormalities. Again, leading to the question, how clinically significant is enlargement of these joints? There were several limitations, many of which were discussed in the paper, but some which I've added to. We know that this was not a completely sound and neurologically normal population. By looking at the exclusion criteria, only horses with grade 2 out of 5 or greater and 2 out of 4 or greater for ataxia were excluded. So we know that it's likely that some of these horses were not sound. Further, the exclusion criteria didn't adequately limit the horses to only mildly lame horses. The lameness examination was quite rudimental, and there are many horses which would potentially have shown greater evidence of pain causing poor performance or lameness if the horses were evaluated under more circumstances, ideally including ridden exercise. Further, the grouping of the grading doesn't really reflect clinical practice. So they grouped mild changes were grouped into mild changes, but moderate and severe changes were grouped together as one rather than as two separate grading entities. And this doesn't necessarily reflect what would happen in clinical practice. And when it comes to the question of what is clinically relevant, I think the difference between moderate and severe enlargement may be clinically important. Further, I think that this may have biased the inter-observer repeatability data. If they did have it as mild, moderate, or severe, the agreement may have been even less, because as it stands, it was almost a binary grading system that either the joints were normal, or they were very mildly to equivocally enlarged, or they were very obviously enlarged. And despite having quite a basic and rudimental grading system, there was still quite a high level of disagreement. The articular process joint between the 7th cervical and the 1st thoracic vertebrae was not included. And from clinical experience, it is just as equally important to evaluate this with regards to it being a site of a large range of motion and potential pathology. And so ideally that would have been included. They didn't discuss why they didn't include it. They did say that ideally perhaps they should have done. It potentially was as a result of them using portable, low-powered radiography equipment out in the field. Often the thickness of tissue and the power that's required to get a high quality radiograph of the 7th cervical to 1st thoracic vertebrae is really quite high. And so that may have been a contributing factor, but again, that is just my theory. Again, it was a portable radiography unit, which does mean there are some limitations of image quality when comparing that with a high-powered gantry-mounted unit. We found out in the discussion that a radiologist was present to oversee the acquisition of radiographs at the event, and they assessed for adequate image quality with regard to exposure and obliquity. That really should have been in the materials and methods rather than put in the discussion. There are, of course, limitations of radiography when it comes to evaluating these joints, but I think putting that into perspective, there are equally limitations of ultrasound, of nuclear skeletal scintigraphy, and of three-dimensional imaging as well, which, whilst is potentially the gold standard of imaging, it is not as readily available and easy to perform this in horses as a result of the location. There was quite a poor agreement of radiologists. This ties into the eventual data set, which was a result of the median scores applied by the three radiologists, makes it quite questionable. There was such a huge variation in the categorization without expert agreement that I'm not sure that it was the best data set to get really robust information from. And so we don't really have a gold standard for diagnosis or, in fact, a categorization of these horses. So, for example, one radiologist would have identified one articular process joint as having been normal, whereas another one would have categorized it as being moderately to severely enlarged. And I think when you have such a wide range of disagreement between radiologists, I don't think we can take the median of that and take that to be the gold standard against which we compare the various variables. So thinking about the clinical applications of the results of this study, I think we need to have quite a lot of consideration with respect to the potential for radiological signs of osteoarthritis, particularly enlargement of the articular process joints, that this may be present without causing any apparent clinical symptoms or performance issues. And this ties into both pre-purchase examinations as well as clinical investigation. Either way, the importance of a comprehensive lameness or poor performance investigation is paramount, and certainly including diagnostic anesthesia for those times when there are clinical signs of neck stiffness or pain or reduced range of motion. It's important that diagnostic anesthesia is relied upon to get a more definitive diagnosis rather than relying on radiography as a form of primary diagnosis. I think this study has shown that radiography is, of course, very useful for this, but it is not useful with regards to primary diagnostic capability. There's obviously very limited agreement between even specialists, and so we should understand that assessment is purely subjective at this point of time. And of course, I think this raises more questions. We certainly need to know more about this. Ideally, we need to have some longitudinal studies so that we know what happens to these horses. Is it known that, or a fact that these horses can have enlarged articular process joints and they do not and may not ever cause a clinical problem? Or perhaps does it mean, or is it likely that these horses may develop a clinical problem in the future? And similarly, I think comparative imaging studies would be really important, particularly comparing radiography with three-dimensional imaging, whether that be MRI or CT. That would allow us to learn a lot more about the radiological signs that we are seeing and allow us to relate it to clinical practice and our clinical findings much easier, which at the moment, as we have found out, is really quite difficult. Thank you very much for listening to this installation of the IMV Imaging Journal Club. If you have any questions or comments or personal experiences, we would love to hear from you. You can contact us via the usual platforms, including social media pages or our website, www.imv-imaging.co.uk. Thank you very much for listening.